This is Buck Smith talking about some Achilles injuries. We've been seeing an increase in Achilles ruptures in the NFL here recently. It's kind of been all over the news. Um, the Achilles rupture rates haven't really changed to the best of our understanding, but certainly some high-profile athletes have had Achilles ruptures here recently. There's also some controversy about whether different types of field turf versus regular grass plays a role. And again, this has been studied a couple different ways, and there's not a consensus opinion that field turf or astroturf increases ruptures as compared to regular grass. Um, I think the rate of Achilles ruptures hasn't really changed, but more just the density and the high profile athletes that have had them. So it is not the case that we're seeing a whole really large spike in ruptures, but more that certainly the Aaron Rodgers rupture 4 plays into the season, and then some other high profile athletes missing the whole season because of an Achilles rupture. There's also a bit of rumblings and talk about um, Aaron Rodgers specifically coming back within 3 months after an Achilles rupture, which may happen, but I would be very surprised. In general, for our patients, when we treat them with an Achilles rupture, it takes about 5 to 6 months until you're even able to jump off of that one leg. So while it's certainly possible that you could come back and play some sports and being a immobile quarterback may be doable. I would be very surprised if he came back and played at a very high level, although professional athletes surprise us a lot of times with their quick recoveries. In terms of injury prevention, the number one thing is really stretching. So, the thing that you can do to prevent or at least decrease the risk of suffering an Achilles rupture is making sure that you're really getting a good warm up, 5 to 10 minute, 5 to 10 minute warm up of either a light jog or stationary bike before you work out, and then a good dynamic stretch. So the number one type of stretch is the eccentric stretch, but really any sort of dynamic stretch is very, very helpful. And then a nice cool down period, and at the end of your workout, again, just trying to remain limber so that the tissue is less prone to acute rupture. If you do suffer an Achilles injury, we'd be happy to see you at any of our signature locations in South County or Fenton.